Hi, I'm Helen Woodrow.
And I'm Amy Rush.
And we're both highly specialist speech and language therapists working at EG Training and Speech and Language Therapy.
This vlog is part of a series of vlogs that we've created to tell you more about the specialist speech and language therapy services that we provide.
This is vlog number 3 in our series, and it's all about the tongue. So the tongue is really important in all sorts of oral functions. It's very important for eating, drinking, swallowing, saliva control and speech. Normal development of the tongue is quite complicated. As a baby, we start off with a forwards and backwards suckle movement of the tongue. The sort of speech sounds we're hearing at this point are very open sounds because the tongue isn't doing much movement in producing other sounds. As a child starts to eat their first solid foods, a more mature suck and swallow develops with more backward movement of the tongue to help propel those solid movements, the solid foods. Back sounds like k and g start to develop at this point. As harder chew foods are introduced, a more sideways movement of the tongue develops to help with chewing and moving those foods around the mouth. Next we see tongue tip elevation, which means the front of the tongue moving up. This helps with moving food around the mouth and from the palate. We start to see sounds like t, d, l and n developing, as these all need the tongue to move up. After this, the last movement we see is back of tongue side spread, which is a very mature movement pattern of the tongue, where the tongue pulls backwards and the sides spread out. Sounds like e, ch and sh use this movement pattern. There are all sorts of difficulties that people can experience with tongue development. In a syndrome such as Down syndrome, we often see low muscle tone, and this results in tongue protrusion or a forward falling of the tongue. Difficulties with backwards and sideways tongue movements mean difficulties with chewing, swallowing and producing clear speech sounds, which again we often see in Down syndrome. That forwards position of the tongue can also lead to dental difficulties as teeth development. There's a vlog which is number 7, which gives lots more information about Down syndrome and the sort of difficulties a person with Down syndrome may experience. Within a difficulty such as cerebral palsy, we often see reduced tongue control. The tongue is under muscular control, and it is in fact a muscle, so the same sort of difficulties we might see with the body, we see with tongue movement. The tongue may be tight and bunched at the back of the mouth, or it may thrust forward while eating and drinking in an uncontrolled way, all of which produces difficulties with swallowing, processing food in the mouth and clear speech. We have a vlog which is number 8, which looks more at the difficulties experienced by people with cerebral palsy. Some people also have a tongue tie, which means that the bottom of the tongue is tethered to the bottom of the mouth. This can restrict tongue movements in all sorts of ways, including upwards and forwards tongue movement and sideways and backwards tongue movement. This affects speech production and eating and drinking, amongst other things. There are lots of ideas that we can incorporate in working with tongues to help with tongue movements for eating, drinking and swallowing and speech sound production. Some people require extra sensory stimulation of the tongue to help with position and movement of the tongue. We often use vibration, or in a very small child, you can use your fingers for this. Straw drinking is an excellent activity for helping with tongue retraction particularly. The Talk Tools straw hierarchy is a really important therapeutic approach to work on this. We can teach straw drinking using something like a honey bear. This helps to teach by having a soft straw and the ability for the supporter to squeeze the liquid to start off that skill. As the skills develop, we can work through a hierarchy of straws. There are all sorts of straws in the hierarchy. They look great fun to use, but they have a very important role in teaching tongue retraction through drinking from a straw. As we develop through straw drinking, a mature suck rather than an immature suckle can be developed to help with mature movements of the tongue. We can use prompt, which supports correct tongue placement for speech. This is tactile stimulation on the face and is talked about in more detail in vlog number 10, which deals with specialist techniques that we can use. We can also use specialist feeding techniques using a fork or a spoon to help to develop mature tongue movements. Something like the easy spoon can be used to help develop backwards and sideways movements of the tongue. Therapy activities can be used with a newborn baby right through to an older adult to help develop tongue movements for speech and feeding. Being able to assess a person's needs and devise specific activities to meet those special needs is part of the specialist speech and language therapy service that we can offer, using specialist assessment techniques and then writing a programme of activities that a parent or a carer can follow.
Thank you for watching. We hope you enjoyed that and found it really useful.
Don't forget, this is just one of a series of vlogs, so please do check out all the others as well.
And to get a lot more information, please visit our website at www.eg-training.co.uk.